Hello friends, in this video I am going to explain about sickling test. In this image we are seeing RBCs, which is normal in shape, and some crescent shaped RBCs. Sickling test is basically about diagnosis of this sickle shaped RBCs. After watching this video, you'll come to know what is sickling test, the purpose of sickling test, the types, the advantages, their limitations, confirmatory test, and the clinical importance. Now first, let us see what is sickling test. The sickling test is a diagnostic tool, helps in diagnosis of HBSS, which is sickle cell anemia, and HBAS, sickle cell trait. Next we'll come to, let's have a look of hemoglobin. What is hemoglobin? Hemoglobin is a metalloprotein which is a combination of metal plus protein. Metal here is iron, and the protein helps in formation of the chains of the hemoglobin. Here we have an image of hemoglobin, alpha 1, alpha 2, beta 1 and beta 2 along with the iron. Next we'll see the types of hemoglobin. There are basically three types of hemoglobin. First one is adult hemoglobin, secondly we have fetal hemoglobin, thirdly we have sickle cell hemoglobin. First we'll come to adult hemoglobin. Adult hemoglobin contains 4 chains. It has alpha 1, alpha 2, beta 1, beta 2 chains. This is the image of adult hemoglobin having 2 alpha chains and 2 beta chains. Next we'll see fetal hemoglobin. Fetal hemoglobin also contains 4 chains, but here the difference between adult and fetal hemoglobin is the beta chains are replaced by gamma chains. Here we have chains like alpha 1, alpha 2 and gamma 1 and gamma 2. Here we have image of fetal hemoglobin. Here we have 2 alpha and 2 gamma chains. The gamma chains are responsible for higher affinity to oxygen so that the developing fetus can receive more oxygen for its organs. Next we'll see sickle cell hemoglobin. It also contains 4 chains, but like adult hemoglobin, it also has alpha 1, alpha 2, beta 1 and beta 2 chains. But the difference between adult and sickle cell hemoglobin is the beta chain is mutated gene. Here the beta globin chain of the 6th amino acid is glutamic acid is replaced with valine. Now we have an image. On the left side we have a normal hemoglobin, on the right we have the hemoglobin S, which is a sickle hemoglobin. Here on the beta 2 chain and beta 1 chain the glutamic acid is present, while in the sickle cell hemoglobin we have, instead of glutamic acid, valine on the beta 1 and beta 2 chain. Next we'll go with the sickling test. The sickling test is a diagnostic test used to detect the presence of HBS, which is a sickle cell disease, and a sickling cell trait, HBAS. Here we have an image showing us the sickling cell along with the normal RBCs. Next we'll see the purpose. It is used to screening sickle cell anemia and sickling cell trait. It is commonly used for screening of neonatal, antenatal and population of high prevalence area. It also helps to differentiate between normal person with the carrier and also conditions with disease. And next we'll see the types of sickling test. Firstly, we have microscopic sickling test using sodium bisulfite, which is traditional method, and secondly we use solubility test. Here the turbidity is used for determining the test, which is a rapid screening test. Next we'll see the microscopic method, which is using sodium metabisulfite. First we'll see the principle. The sodium metabisulfite is a reducing agent and removes the oxygen from RBCs, which gives a condition with low oxygen level, which initiates the HPS to polymerize and make the RBC shape from normal biconcave to the sickle shape. This sickle cell formed is seen under microscope. The requirements for this microscopic method: firstly, we need a fresh anticoagulated bed, which is EDTA, and we need a sodium metabisulfate, which is 2% solution. And thirdly, we need a microscopic slides and cover slip. Also, we need to have a light microscope to observe the result. Fifthly, we need a dropper and applicator stick. Like this, this is the image showing the microscopic method. Here we are adding a drop of blood along with 2% metabisulfate and mixing it thoroughly with the applicator and adding a cover slip on it and sealing the cover slip with the petroleum jelly and leaving it for 1 to 2 hours and then observing under microscope. Now let us go with the procedure. Place a drop of blood, as I said before, on a clean glass slide. Add an equivalent drop of 2% metabisulfate solution. Mix and add a cover slip. Then seal the edges with the petroleum jelly so that the oxygen is prevented entry, and we have to make it stand for 1 to 2 hours. Then we have to observe under 40x microscope. The interpretation here is, if the sickle cells are present, then the HPS will be positive. Here the HPS may be a trait or a disease. If the no sickle cell, only round RBCs are been seen, then it is negative for HBS. Next we'll go with the solubility test of sickling hemoglobin. First we'll go with the principle. The HBS is insoluble and deoxygenated under condition. When treated with the reducing agents like sodium dithionate, the HPS forms crystal which makes the solution turbid. The normal adult hemoglobin remains clear while the HPS forms turbid precipitate. The requirements for the solubility test are EDTA sample, sodium dithionate, and saponin or phosphorus phosphate buffer, which helps in RBC lysing agent, and the test tube or a slide. Basically we use test tube rather than slide, and we need a light source. This is the image of a solubility test. This is a sickle cell one, which is positive, solubility positive, and this is the normal one. Here the light can pass through the tube because no precipitation, while here the precipitation and HBS is insoluble in the solution, so the light is not passed. Then the procedure: will mix 2 ml of working buffer with 20 microliters of whole blood along with 0.1 gram of sodium dithionate. We'll mix this 3 and incubate at room temperature for 5 minutes, then observe against a light or white background. Then the interpretation is, if the turbid or cloudy, it determines the positive HBS is present. If the solution is clear, then it determines the test is negative and no HBS. Then we'll come to the advantages of sickle cell test. Firstly, it is simple and low cost. It is rapid, especially in solubility test. And thirdly, it is useful for mass screening. And fourthly, there is no need of sophisticated instruments. Now we'll see the limitations of sickling test. The sickling test cannot be differentiate the sickle cell trait versus sickle cell disease. It can give false negative in conditions such as newborn, due to high presence of fetal hemoglobin and in the severe anemic conditions. And confirmatory tests should be done, like such as electrophoresis and HPLC. Then we'll go with the confirmatory test. Firstly, we'll do hemoglobin electrophoresis, which separate different hemoglobin types based on its charge. And secondly, we'll do HPLC, which is high performance liquid chromatography, which helps in quantifying the percentage of each hemoglobin in the sample. Next, we'll come to the clinical importance. Firstly, it helps in diagnosing sickle cell disease, HBSS, and secondly, it helps in diagnosis of sickle cell trait, HBAS, and compound hemoglobinopathies such as HBSC and HBSD also be diagnosed, and important for prenatal screening, genetic conclusion, blood transfusion safety. Thank you.